Welcome to GenePower. How can I assist you?
What is genetic testing?
A genetic test is a blood or saliva test which can help identify the genetic mutation which causes cancers in the family. It can help in deciding the further need of screening and risk-reducing measures in case of a positive report. If the test comes negative, it can reduce the anxiety of the individual or family members.
What are hereditary cancers?
Cancers caused due to a change or mutation in genes present at birth are called hereditary cancers. These mutations are usually inherited from either of our parent. Individuals having these mutations are at an increased risk of developing cancers.
Are all cancer cases hereditary?
No. Only 5 to 10% cases of cancer are hereditary in nature. Further evaluation like family history of cancers, age of diagnosis, the type of cancer followed by a genetic test will be needed to better understand the risk for hereditary cancers. Genetic counseling can be availed to access your risk and make an informed decision.
What if my result is BRCA positive?
A mutation in the BRCA gene increases the risk of a woman to have breast cancer by 50 to 85% and ovarian cancer by 40%. In such cases, if we already know that the person is at increased risk, periodic mammography or similar tests help in early detection of breast cancer. Preventive risk-reducing or prophylactic surgeries such as an oophorectomy or removal of ovaries and mastectomy or removal of breast could be explored at appropriate ages.
Where can I get more information on BRCA testing?
You can go through Force, Ambry Patient Brochure, Komen.org, nsgc.org to know more about hereditary cancers.
What is the use of multi-gene testing over BRCA gene analysis?
More and more genes are getting associated with hereditary cancer risk. Even if BRCA report comes back negative, there might be a mutation in some other gene increasing your risk for hereditary cancers. Therefore, usually multi-gene testing is preferred. Please discuss with your genetic counselor or physician to understand the best test for you.
What if my cancer test result is positive?
This report does not mean you will get cancer. It means you are at an increased risk for cancer. There are potential benefits such as early cancer detection through increased screening, take appropriate risk-reducing measures and make lifestyle changes to further lower your risk for cancer. This may also help to address your concern for your children or siblings' risk for cancer and make informed choices about their future. The risk differs based on mutation is found in which gene.
What happens at a genetic counseling session?
A genetic counselor is a healthcare professional who is trained in medical genetics and counseling. The counseling sessions start with the counselor taking a detailed family history. This is followed by a risk assessment using international medical criteria, guidelines formulated by National Comprehensive Cancer Network and American College of Medical Genetics. Based on the risk assessment, further options about your cancer risk and risk of cancer in your children and relatives will be discussed. This will help you make an informed decision for you and your family member for hereditary cancers.